Hi, I'm Sean Karbowicz. I'm the founder of MedSavvy. In this video, we're going to talk about wasteful prescription spending and how MedSavvy can work with your prescription benefit to eliminate wasteful prescription spending and improve the health of your employees. So the challenge is that we have some medications of high value and some medications of low value in various medical conditions. For example, on this slide, we have two medications for depression. And you can see that one medication is rated B, meaning that it's pretty effective for depression and it's low cost. Another medication is rated C, meaning it's moderately effective, but it's high cost. So the challenge is that we have some medications that we pay a lot of money for that are good value, and we have some medications that we pay a lot of money for that is low value. To address wasteful prescription medication spending, we really have to have a conversation around medication value. It's medications that have low value that we need to address if we're going to eliminate wasteful prescription spending. So let's think about some of the things that we could do to eliminate wasteful prescriptions. In order to do that, start to think about yourself and your own family, because anytime we have a policy or we implement a new program, we have to think about how it affects the patient. So I'll ask you to first think about the last time you got a prescription medication. How did you know it was worth it? How did you know it was worth stopping at the pharmacy on the way home? How did you know it was worth remembering to take the prescription? How did you know it was worth the side effects? And that's not even talking about the worth or the value of the drug when we consider it in terms of price. So here's a story that highlights the problem. I was at a conference a few years ago talking about comparative effectiveness of cancer medications, because some cancer medications have been proven to extend life, eliminate cancer, improve overall survival. And some cancer medications only really have some promise of effectiveness. So how can a person tell the difference between what's been proven and what only has promise? And as I was discussing this, in the audience, a patient was there and he raised his hand and he said, "Sean, I would love to have had that information when I was going through cancer treatment myself." You see, the problem that we have is that there are some medications that are of high value and some medications that are of low value. How's a patient to tell them apart? And this isn't just related to cancer medication. This is related to depression, anxiety, blood pressure. There's lots of conditions where we have many medication choices available. So in this slide, we see the price of medications over the past 10 years, and the prices are continuing to increase. And we think there's a strong correlation between the lack of transparency of medications, value and pricing, and the overall price of medications. You see, if people can't shop and compare medications and determine which medications are the best value, they're not going to have any incentive to select the lower cost therapies. So as a result, prices rise overall. So this is not a surprise to health plans and employers. In other words, we've known for a while that there is this dilemma that we have of differing medication values and a tight correlation to rising overall costs. So health plans and employer groups have put processes and different techniques in place to try to drive traffic or drive use of high value medications and discourage use of low value medications. What are some of the ways that we've been doing this over time? One is through higher deductibles. The idea is that by raising deductibles and out-of-pocket costs, consumers will be incentivized to shop for better value drugs. The problem is they often don't have resources or tools readily available to select those better value therapies. Another technique that's used are prior authorizations. Prior authorizations restrict access to the low value therapies and encourage the use of better value medications. While that's effective, it can have some downsides as well. We also see very complex formularies. Again, these are developed to encourage people to shop. I've seen up to 6-tier formularies with varying benefit designs, co-payments, co-insurance, etc. But that's just very complex and can be a hassle for consumers. And another technique are narrow networks, restricting access to certain pharmacies and trying to drive volume discounts to lower prices and lower costs for consumers. So what's the effect of these practices? Well, costs have continued to rise. We certainly haven't seen, and nor are we expected to see, costs start to go down. We also see significant member and provider friction. I used to work at a health plan, and my name went out on 100,000 prior authorization letters every year. I did not get a lot of thank you cards. In fact, I got a lot of complaints. It was a dismal consumer experience. And finally, we're seeing subpar innovation as pharmaceutical manufacturers introduce Me Too products that have prices even greater than their competitors. So enter MedSavvy. MedSavvy is an online service that allows consumers to compare the safety and effectiveness of medications for a given condition along with their personalized costs. Well, not only can people research medications, but they can also be alerted to medication information that's relevant to them. By looking at claims data, we can identify when a consumer has an important safety or cost-saving alert they need to be aware of. So what is MedSavvy? Well, MedSavvy offers transparency in medication choices, where consumers can compare the safety and effectiveness and costs of medications and select the therapy that fits them best. They can also shop at pharmacies when they find a medication and get it at the lowest price. So in addition to being a reference, MedSavvy also engages consumers when there's something important they should take action on. We import claims data and we examine claims data looking for opportunities for consumers to switch to a lower cost medication. In addition to being a transparency reference, MedSavvy also examines claims data behind the scenes so that we can alert a consumer if there's a medication they can switch to save money, or if there's a medication that potentially has a safety alert they need to be aware of. So we believe that a different approach gets different results. MedSavvy contrasts with the health plan restrictions by offering concierge pharmacists and pharmacy information that helps consumers make better decisions on their own. It's designed to be consumer friendly from the ground up, and it's personalized information so consumers can trust it and take action on it. In fact, 75% of people who sign on to MedSavvy take some sort of action in the platform.
So what type of results would we expect to see with MedSavvy? Well, we would like to see behavior change and cost savings. And what we're showing you here are the results of a 5,000 employee company that we've been serving for the past couple of years. You'll see growth in value that's been delivered to the employer over time. In fact, for some employers, we're seeing greater than a 3-to-1 return on investment in terms of prescription change savings. And that savings benefits not only individuals, but the employers themselves. In our experience, the employers who allow us to engage their employees the most can get the best results. So why MedSavvy? Well, obviously, there's a great opportunity to save money, and we've talked about that a little bit. But there's also a tremendous opportunity to help your employees be even healthier. As we've talked about, there's differences in medication safety and effectiveness, and people just don't know about that information. So we believe by putting that information about safety and effectiveness in front of employees, they're going to make better decisions about their medications and ultimately can be healthier. We've seen this lead to increased satisfaction. We survey our customers and we get very, very different results from, say, prior authorization or restricting access to medications.
To get more information about MedSavvy or to request a demo, click the link below. Be sure to visit us at medsavvy.com, and you can sign up for our email list to get helpful tips and to sign up for our webinars. You can also email us at sales@medsavvy.com. Thanks for watching.